and thank you for joining us for the latest installment of Nova Healthcare Administrators Spectrum Series, this time focusing on benefit design tiers. Today's presenters are myself, the product manager for Nova Healthcare Administrators. We also have Todd Martin. He is the Chief Sales Officer. Todd develops sales and marketing strategies and objectives, cultivates relationships, uncovers concerns, and shares his perspective to make sure his prospects' expectations align with Nova's capabilities. Todd joined Nova in 2010 and has helped Nova expand into new markets, grow in membership, and has led the charge offering Nova as a solution to other TPAs and health plans as a back office partner for claims administration and medical management. We also have Charlene Zielinski, Director of Client Services. Charlene leads a team of client service associates for Nova's self-funded medical, dental, vision, COBRA, and reimbursement clients. Charlene has more than 15 years of experience in the insurance industry, including a focus on account management, client retention, and network analysis. She has been working with Nova's clients for more than a decade. Jamie, our Vice President of Health Plan Performance Management, is responsible for proactive market research, data analytics, and product strategy development designed to mitigate client cost trends. She leads research, development, and implementation of client-specific initiatives, driving the direction of operational business units with the goal of improving clients' financial performance, the health of their members, and providing oversight to ongoing trend analysis through data analytics, client reporting, medical management strategy-related processes, policies, and procedures, as well as clinical training, quality assurance, and clinical platform configuration. And I'm Teresa Vincent, the product manager. I've been in the health coverage and benefits industry for a decade. I have a lot of knowledge of regulations, compliance, and products across all different types of insured benefits. And prior to working in health benefits, I spent a dozen years working as a communications professional in state government. I also have a master's degree in healthcare administration. So that's our team in a nutshell. What Nova does since 1982, celebrating our 40th anniversary this year, managing trend, reducing healthcare spend, and improving health plan performance for self-funded medical, dental, vision, COBRA, reimbursement account administration, private label partnerships, such as Todd helps us set up with other TPAs, direct primary care, level funded, which we will talk about more in a moment, and also reference-based pricing. Now, when we start talking about the spectrum of health plan performance management opportunities, it's really useful to think of this visual image of the band of white light coming into a prism and then all that white light being refracted out to all the different colors. So if you think of your company profile as the white light source going into the prism of the TPA, all the different colors will give you network, telehealth, wellness, medical management, pharmacy management, benefit design tiers, and reimbursement. We have already done 5 webinars on the first bands of the rainbow, and today we're here to talk about the indigo level benefit design tiers. Now, when you hear benefit design tiers, you may think of a couple of different things. So if you're familiar with the ACA world and you know the metal tiers that are in the small group and individual benefits, that's not what we're talking about today. We're also not really going to dive in too much on things like tiered benefits within a plan. We want to look at level funded, standard designs, and highly customized benefit designs. So beginning first with level funded, that's really more of entry level opportunity for small groups to shift from a fully insured to a self-funded arrangement with a higher level of protection from the variability in cost that they would expect to see for self-funded. It's sort of has a lot of guardrails on it to make that a very palatable option for small groups that are curious about self-funding. Next up, we would talk about standard design, such as if you're a group that is new to switching from fully insured to self-insured, maybe you just want to replicate your current plan design with your carrier. Maybe you've been doing self-funded for a while and you like things exactly the way they are. You want to keep them the same, but maybe you want to change your TPA. So what can we do to replicate your current plan design? And what should a TPA be able to provide to you as additional services there? And then finally, we want to talk about highly customized plan benefits. So how do we provide recommendations to plan design based on your population's health and your client's goals? And you'll see how this all comes together as the spectrum from this initial look at level funding, which Todd is going to give us an overview of as the starting point of our benefit design tiers. Take it away, Todd.
Yeah, no, thank you, Teresa. And so over the last handful of years, there's been a very, very large trend of smaller employers transitioning to self-funded programs. And essentially, I think the reason behind that is they're looking for more transparency. They want to understand why their claims are going up on an annual basis, and they want to have a little bit more control. There are multiple different types of employers, but the smaller employers, from what we have seen historically, they make decisions later. They might not start looking at their benefit renewals to 60 to 90 days prior to the effective date. And oftentimes, when you're looking at something closer to the effective date, you obviously have less time for education and implementation. So many of these smaller employers, and when I say smaller, usually, it's under 200, most of them that are looking to transition away from a traditional BUCA fully insured program, oftentimes a level funded solution is truly the best next step. And the reason that is typically it's turnkey, right? So you'll have custom plan designs that you have an option of. They're typically off the shelf, and you know what you're going to pay on a monthly basis. So one of the biggest hurdles to people transitioning to self-funding sometimes is obviously the management of cash flow. In a traditional self-funded model, you're funding claims on a weekly basis, and that dollar amount changes every single week. It's very rarely ever going to be the same. And so for a smaller employer that might not have a sophisticated finance team, or they're tight on cash flow, they really want to know what they're going to pay on a monthly basis. They want the benefits to self-funding, but they just want to pay one fixed cost. So we have level funded partners that may use level funding as a bridge or a transition tool away from the fully insured environment. And then we work with other partners that truly just stay on a level funded platform for an extended period of time. And the nice thing is when you're working with a true TPA that's providing that level funded solution, once you start to capture data, we can have conversations with the consultant and the employers on how they can potentially pay for things a little bit differently. And that's oftentimes when level funded might just be a bridge or a stepping stone into a more creative, truly self-funded approach. But when you're taking a look at the level funded solutions that are out there, there's multiple options, right? So there's the big carrier options, and oftentimes they're still turnkey, they're easy, but they're really not much more than a fully insured platform with maybe some additional reporting. And these types of level funded programs might not necessarily work as that bridge to a more unbundled self-funded approach, because you're not really going to have necessarily insight into the claims experience of how the group's utilizing the plan to create more customization. So when you're evaluating the level funded solutions out there, oftentimes the carriers as well, they won't return any sort of a claim surplus. So if the group runs well and there's a large claim surplus at the end of the year, then the carrier might only return 50% of that claim surplus, and it's in the form of an admin credit, and the group has to renew. Those are typically the way the carrier models work. In the TPA space, oftentimes you'll see different TPAs with different stop loss carriers. And when you drill down and really look at a lot of the premium equivalents that are coming out of these models, oftentimes when you look at the premium equivalent, the fixed cost might be 80% of that equivalent, and the claims are actually 20%. So in those cases, you're really never going to have an opportunity to have a claim surplus at the end of the year. Historically, in a TPA model, you should get 100% of that claim surplus back. But if obviously it's only 20% of the premium equivalent, those chances are low. So with the program that we've created at Nova, it's a true self-funded product, but we made it easy for smaller employers that make decisions closer to the effective date to implement them in a shorter amount of time. We put together best-in-class plan designs that we feel could fit the need for all employers out there. We've built 6 months of run-in into all of these contracts, so that after that 6-month run out, 100% of the claim surplus is passed back to the employer. All of our programs include all of our cost containment solutions and strategies when it comes to utilization management, disease management, case management. And we also work with PBMs that are transparent. They build formularies that truly drive utilization to the most cost-effective drugs and pass on 100% of that those rebates on a quarterly basis. So when evaluating it, you want to make sure that you're working with a partner that's truly managing your costs to the best of their ability and really building opportunity for a claim surplus. And another area where you increase your opportunities for claim surplus is making sure you have a specific deductible on that level funded solution. If you have an aggregate only product, one member can blow through the entire claim surplus, but if you have a specific deductible, if you have one high cost claimant, their liability and exposure to the plan is capped, which ultimately will increase, the opportunity for a claim surplus. And then also too, all of our programs are quoted on 125% aggregate corridor, which means that there's a significant dollar in that premium equivalent that's attributed to the claims fund. So level funded products, there's a lot of different ones out there, but make sure when you're evaluating the solutions that it's truly something self-funded and is really being managed to the best interest of the employer group. And you do lose a little bit, I guess, of the bells and whistles in terms of flexibility and maybe some of the customization that you can get in a true self-funded world. But like I said, oftentimes the level funded solution could be a bridge or a stepping stone into some of the other different types of plan designs that we're going to discuss next.
Well, and that's an important point that you bring up, Todd, about the flexibility. So one of the advantages of self-funded is, of course, that ability to do a little bit more customization. It's regulated differently than, say, like the Affordable Care Act plans or the large group plans that if you go fully insured. So when you talk about benefit design tiers in, say, the ACA universe, where it's your bronze, gold, silver, platinum, those are very defined benefits. They're done by nationally based calculators. Whereas in the self-funded sphere, when we talk about benefit design tiers, we're really talking more about levels of customization and how we can have more responsive benefits that are attuned to the needs of our different groups. So now we're going to talk a little bit about the standard plan design when a group wants to come over to either be self-funded for the first time if they're a larger group, or if it's a group that we've worked with for a while or is coming from a new broker and they want to kind of keep things the same way. They don't really want to make a lot of changes or leap out with a lot of customization first. So Todd, can you walk us through how it looks when a standard plan design comes into our organization?
So historically, employers can come to us and they can ask us, what's a good plan design? What should my group do? What have you seen success with? And there's not really like this one size fits all approach, right? There's not just one plan design that seems successful because we don't really ever know anything about an employer before they come over to us. Sometimes we can get a high level detailed claims experience. That's traditionally, groups of 500 and up. If they're with a carrier, they may have access to more details of a claim file. We can take that data, send it over to our health plan performance team to analyze it ahead of time to potentially make recommendations. But for the most part, we just traditionally, duplicate where the group's currently at, and then we could potentially make recommendations, down the road. But, I would say probably 75% of our traditionally self-funded clients, they're not really doing unique things coming out of the gate when they come over to us. A lot of times they're coming from a BUCA plan where the plan designs are truly just a mirror of something that's fully insured. And they're coming over to us because they want to do something a little bit more innovative, but it's not necessarily the first day when they walk through the door because we just don't really understand on what's driving the cost within that population. So all of our clients, I would say, which sometimes can be difficult, have different plan designs because we typically meet the employer in the beginning where they are and where they are for their readiness for change.
So Charlene, I know that's something that you work with a lot once we are managing the account over the long term. So can you talk from a client service perspective of how that looks and how ongoing maintenance works?
Of course. So as Todd said, most of the time the groups are coming on, they're going to mirror their current plan designs. And it's the biggest part about that is it's the best benefit for both the employer as well as the members. It's already a change going from a carrier to a TPA. So they try to reduce that and just mirror the current plan design. As we get to know the client through trend management and everything, we can start to make those plan recommendations down the road. But during the implementation process, it's really the most important thing that our clients have conversations with whoever, be Nova or any of your other TPA partners or carriers, that you want them to understand what the plan's expectations are. You want to hear about their prior challenges as well as successes. Hearing those is going to help the plan be more prepared to hear any of those struggles that the members may be having and report back to the client. You want to also know if the group is plan cautious or cost conscious on it to make sure that if the funds are something that's really the struggle with the group, you want to make sure that you know that. So you're not trying to go and make plan recommendations versus a group that wants to have something where they want the most extensive benefit package to recruit and retain employees. Knowing that information helps to make recommendations going forward and to have the most success of the plan. Also, you want to make sure that whoever you're using has the ability to have conversations internally to understand what the plan is. So right now we have conversations with our care navigators and our entire operations team to tell about the new client, to tell them all their expectations, the challenges that they've had, the successes that they've had as well, to make sure that they have the best experience possible with NOVA or wherever you're going to go.
And also in the product sphere, if I could just add in before we move to the clinical data, it's also important to know if they're bringing any point solutions along with them that we would also need to get integrated and set up so that we make sure that that is an uninterrupted experience as well. All of which ties into our clinical data and the impacts of monitoring that spend. So Jamie, can you walk us through some of the plan design changes that come through that access to clinical data?
Of course, thank you, Teresa. So as Charlene discussed, it's truly important to understand client-specific goals and current satisfaction or pain points with the current plan or plan design. And through clinical data consumption and highlighting company goals, the custom recommendations and strategies are enabled for each client. If there is a best practice solution that a consultant or a client is currently offering, certainly assess the comparable solutions offered by the new plan. Or if none are available, work with a partner who can implement and integrate with that solution. A best practice for this is to promote the utilization of those benefits and point solutions, like Teresa mentioned, through care navigation and really enable it through case management support. Through that customized education of those benefits or referral processes, it really benefits the part of the standard plan offering and really enables those services to be utilized. Once the plan is implemented, plan utilization should be monitored and key success metrics should be assessed for the strategy using the clinical data outcomes and claims cost. One example of a standard program at NOVA is our Transitions of Care program, which includes registered nurse telephonic outreach to members after an inpatient stay when a member is discharged to home. With this program, we're monitoring readmission rates at 7, 14, and 30 days for members who have and who have also not engaged in our nurses outreach assessment. We are also able to estimate savings from readmission avoidance of this standard program. So really monitoring the metrics at an initiative level, even if it's offered within a standard plan design, helps to gauge what's working or where the plan may need to pivot on their strategy. And that's really where the highly customized approach comes in.
Right, so we are able to do some tailoring within the standard sphere, but it's a little different from highly customized, which is where we start going into a lot more detail and look a little bit more deeply at some of the goals and objectives of the clients. So Todd, could you walk us through that more highly customized approach from a sales perspective of when you're going out meeting with broker partners? What are you hearing?
Yeah, so, there's a lot of buzzwords in the industry. There's a lot of point solutions that are popping up across the board, So for the conversations I have, it's really understanding where the group is today, right? So we bring on new clients every day that have membership that is experienced, they're educated, they understand their plan design, and they know the uniquenesses to it. Because some members or employers might have, 5 different types of point solutions that might be helping managing different types of cost drivers, whether it is, some sort of diabetes vendor or an MSK vendor or cancer care. When we bring on those solutions, we can have the flexibility to bring all of those pieces together, right? And leveraging care navigation, we can help steer to those different point solutions that add value to the member and more effectively control costs. Other times too, we have consultants that come to us and they want to bring on 5 different point solutions, and they're coming from a fully insured Blue Cross plan. They've, never had any of this customization. And, oftentimes that's too drastic of a move, right? I'm a big believer in the crawl, walk, run approach, but understanding, first of all, what point solutions make sense for this group. And obviously, if you're coming from a fully insured world, you might not know what are the prevalent conditions, what are the prevalent utilization patterns. So to bring a handful of different point solutions without truly evidence to back it up, like, it just doesn't make any sense. So in those situations, we try to, talk to consultant backwards a little bit and try and maybe take more of a long-term strategy and path and bringing some of these levels of customization forward. But, we're also seeing more employers across the country maybe contracting with somebody, in their backyard, right? So I met with an electrical company, in February, and 500 electricians, they have a lot of, orthopedic claims because these people are working with their hands above their heads all day. They're sure they have bad shoulders. And this employer went to an orthopedic specialist in their backyard, negotiated their own direct contract, right? Where now the membership can go for no out of pocket. And so we know these people aren't avoiding care. They're taking care of themselves because there are no cost barriers. But we also know on the back end as well that the employer is paying a very competitive rate. So in those solutions, we obviously have the flexibility with our claims platform to build it in. We have the hand holding with our care navigation to help further educate. We have the expertise of our marketing department to be able to explain this and roll it out effectively to the employees for a successful utilization of it. But yeah, you really have to meet every employer where they're at. I feel like that's a repetitive theme that I always say. But we have seen employers come in and, immediately want to throw in, say 5 different point solutions within their plan design. And, it just becomes confusing for the membership. The employee satisfaction is awful. And it might not end up being a long-term client for Nova, because when these people look down at their ID card, they see Nova and they think Nova's bad, right? But what we're doing really is just putting together the program that was customized maybe by the employer and the consultant. But collaboration on it is key, because we've obviously worked with hundreds of self-funded employers over the years. And so we kind of know what works and what doesn't. And so leveraging, our experience, understanding the employer, and working with the consultant, usually we can come to, a happy place that's a win-win for everybody.
Right, and that collaboration piece is really essential. So Charlene, I know that's really what you do pretty much all day, every day, is working in collaboration with our clients. So can you talk a little bit about how that looks from the highly customized perspective?
Of course. So as I said earlier, understanding the client's expectations helps to manage their plan and as well control their costs. So really the biggest part is now that we can make these customized plans are we want to understand what their barriers are, that any member may be facing. By reducing these barriers, when appropriate, it does allow for members to get access to care faster and potentially avoid higher cost claims. It also improves member satisfaction, which in turn leads to employer satisfaction, of course. So barriers of care, when we're looking at it, we have care navigators. So our care navigators are navigating our members. Our team is trained to listen to our members and escalate any issues that they might find for one individual, or if they're noticing any type of trends that are going on with a group. We can then take those back and have discussions with the group and implement mid-year plan changes if needed. Of course, we can do it on a renewal, but if it's something that really is a barrier of care, we want to make sure it's addressed right away. Additionally, we work with our medical management team. So we have this broken down into 2 areas. We work with our medical management team on prior auth. And if we're finding that there's trends that are going on, or if we're looking at the data and it supports that a lot of the denials are being overturned, we might go ahead and have a conversation to remove that prior auth so that way we can get faster care for those members. In addition, we're working with the case managers that we're talking about. These are a lot of the people that might be a higher cost claimant or have some type of disease. We want to make sure that if they're having barriers of care, that we're working with the group to implement any changes that we can potentially do for those members as well. It's really important to just make sure, again, when I talked about it earlier, it's having that communication within an organization to identify those members and identify those barriers of care. So additionally, we also work with the health plan performance team to identify trends. These are including, but not limited to, of course, just age-appropriate preventive services. We want to make sure that if someone's going to their PCP, they're getting their mammograms, their colonoscopies. If we're finding gaps, we're going to look into that a little bit further. What might be the gap? Is it really work hours that they're unable to get off of work? Could it be related to the fact that they don't have enough access to PCPs? So we really want to dig in and find out why those barriers of care exist. We'll also look at what the utilization is of the urgent care versus the emergency room, making sure that that's appropriate. We're always at any time able to have member materials provided to a group to help to steer members in the appropriate direction and outreach as needed. We're also looking at the group's top diagnosis codes and seeing if we see any trends with that. As Todd said earlier, if you're in a position all day holding on to, not an electrician, but if you're doing something in a repetitious movement or motion, then you might see those trends exist within the population. And we're just looking for those and making recommendations as needed. And of course, can do it off plan year just to make sure that we get as many people the care that they need.
And Jamie, I know your team backs up a lot of those data reviews. The clinical data team really knows how to slice the data in a bunch of different ways that is very useful to the client services team. Can you just walk us through a little bit about what's working and what's not and how clinical data can impact the spend?
Yeah, absolutely, Teresa. So, this is where evaluating the clinical and claims data is most insightful and beneficial to plans in a self-funded arrangement. As we've highlighted here today, there are several areas of data-driven opportunities for plans and for consultants. So, the one opportunity that I'd like to expand on a little bit more, and Charlene touched on, is really that comprehensive evaluation of the client's prior authorization or pre-certification list to really ensure that it's working as designed as healthcare and medicine evolves. It's important to ensure that the right services requiring medical necessity are reviewed, and that with a comprehensive list, a plan isn't placing an undue burden on members and providers for no reason if services are being approved at 100% rate. So we're really closely looking at those and monitoring those metrics to make sure that our clients have sort of a best-in-class list and approach to that within their plan. Another example is really expanding on what helps to enable the strategies that Todd was talking about with direct contracts. We're continuously monitoring and maximizing the plan participant utilization of those contracts with providers or facilities when they are in place by the plan. And we often surface recommendations for those as well. So when a plan would truly benefit from one in a unique offering, so for example, that's where we really bring the resources to bear associated with care navigation support, who are really trained to educate plan participants on the use of those directly contracted services on behalf of the clients to ensure members receive care in what might be considered a first tier of a tiered benefit design, or maximize the value of a plan design if there are differentials offered based on site of service and where care is rendered. And these two strategies really tie nicely together because a customized prior authorization and pre-certification strategy, along with something where there are direct contracts or a narrow network, in that model, it's another opportunity for the utilization management to be a mechanism for referrals to those directly contracted providers, or to promote care in a more cost-effective tier. So no matter the solution or custom initiative, the processes put in place by your plan or your administrator should be established to monitor the effectiveness of those programs and really enable the services that are customized and offered to the plan participants.
I think it's a really, utilization management is often looked at, this is how plans figure out ways to tell you no. But I think what we're hearing in a really customized, data-driven environment is it actually gives you the flexibility to understand what your needs are and make sure that what you're providing is the services that people need to access. And we believe that it is up to each client and each our broker community to understand each individual group's tolerance for change. So that's why we offer this spectrum, where there may be some where level funded is a great fit. There are some where they want to go highly customized. They want to look at all the different point solutions and innovation and have us help them navigate through that and figure out what fits their workforce. So we would like to continue to engage in these conversations. We encourage you to as well. With, of course, the overall goal of improving plan performance and overall health outcomes for the entire community. We do have coming up in June of 2022 our final installment of the Spectrum series. We will be taking a look at reimbursement, HSA, HRA, FSA. We did receive a question from the audience prior to this session asking about reimbursement plans. So stay tuned for that next webinar. Be sure you sign up to receive that on demand as well. We did also receive one additional question that I want to throw out to the group. And that question is, what new and innovative offerings are beginning or continuing to trend for benefit offerings? And is there anything specific to healthcare? I will just kick this off by saying what I've seen in the product sphere that has been really booming is anything related to telehealth, whether it's MSK solutions like Todd mentioned that are now being delivered virtually, and particularly mental health. We've seen a huge increase in demand for mental health delivered through telemedicine. Anyone else want to weigh in on other new and innovative offerings you've been seeing?
I think we're seeing an uptick of, you obviously mentioned virtual, but everything I guess is really transitioning more digitally than we've seen previously. Everybody wants to engage with their fingertips these days, so there's a lot of different wallets and apps out there. And the nice thing about that is when you increase engagement, you obviously make a more educated consumer. So if you can leverage data to effectively help members navigate where they are in that healthcare decision-making process, we ultimately get a more educated consumer that's making better decisions that will ultimately improve their outcomes, but also control costs for the employer group. So to kind of just add on to what you said with, the virtual and the digital, that's really where we see a lot of innovation and where a lot of things are going. And I'm sure Jamie can, comment to this, but when we have case managers trying to engage with membership, I mean, we can all probably say across the board that not many of us are answering phone calls that we don't necessarily have saved in our phone anymore, right? So if we can effectively engage, at people's fingertips, shoot them a message when they're laying on the couch at night watching TV, people will learn. They will make better consumer decisions around their healthcare, but we're essentially meeting them in that education process of where they want to learn today.
Well, I think that to the point about digital, there are also more price comparison tools out there. There are ways to find more cost-effective providers. We've talked about concierge medicine in health benefits for so long now, and it turns out that the way to get concierge medicine is to actually have it at your fingertips where you can, as you say, look at it 24 hours a day, 7 days a week.
Yep, agreed.
Okay, well, if there's nothing further from our panelists, then I believe that concludes our Indigo session of the Spectrum series. And we look forward to seeing you for the Violet session, which is all about reimbursement. And as always, feel free to follow us on LinkedIn and send us any questions that you may have after viewing. Thanks.
Thank you, everybody.
Thank you.
Thank you.